I'd like to thank everyone for joining us today in today's Grand Rounds talk. And I would like to introduce to you Dr. Deidre Yellowhair, who is Diné, Navajo, and is an assistant professor in our very own Division of Community Behavioral Health in our very own Department of Psychiatry and Behavioral Sciences. She is the project director for the T.R.I.B.E.S project, which stands for Trauma Informed to Build Resilient, Indigenous, Balanced Communities and Enhanced with Strength. This program focuses on raising the standards of care and improve access to services for traumatized children, their families, and communities, particularly American Indian, Alaskan Native communities throughout the United States. And Dr. Yellowhair was raised on the Diné reservation in Arizona, and she has lived and worked in various tribal and non-tribal communities and settings in New Mexico, Arizona, and Michigan. Dr. Yellowhair's research has focused on historical trauma, race and racism, diversity, equity, and inclusion. She has worked in the service of urban and rural Native communities and has committed research and professional focus to promote raising awareness, education, research, and standards of care for tribal communities to have access to culturally safe, collaborative, and historical trauma-informed behavioral health care. And so I would like to hand it off to Dr. Yellowhair on her presentation discussing historical trauma and focus, synthesizing science and the sacred path. Thank you, Dr. Yellowhair.
Thank you, Dr. Chavez, for that introduction. Deidre Yellowhair Yanishia. Ashche in the slash is Nibashin. Twohana dashe do ashihan aiden dashanelle. Akut our aiden saninchne. Good afternoon, everyone. My name is Deidre Yellowhair, like Dr. Chavez said. I'm always humbled when people introduce me by my Western academic credentials, and I always like to follow that immediately with my own credentials, using my native language and using the way that I was traditionally brought up to introduce myself. By doing that, I am not only centering myself and positioning myself in the universe so that my ancestors who came before me recognize my voice and what I am saying, but I also greet you all as my relatives in that way, in a good way. So we start this discussion with good intentions and grounding ourselves in the universe, positioning ourselves in the work that we do in this space of learning. I also utilize my native language in these spaces because, as you'll hear, when I talk about historical trauma, academic spaces weren't really meant for people like me. They were not intended for Native American women to excel and hold positions like the one I'm so fortunate to hold now. So I always call upon my native language to, in many ways, thank my grandparents and thank my ancestors for a lot of what we're going to talk about today. Let me share my screen before I get started. And Dr. Chavez, can I get a thumbs up?
It looks great.
All right, perfect. Today I'll be talking about historical trauma in focus, synthesizing science and the sacred path. Now, if I can get my slide, okay. So objectives for today, I would like for everyone to leave this presentation being able to describe the components of Dr. Braveheart's historical trauma unresolved grief model, identify ways to incorporate Indigenous and tribal language into one's scientific approaches to clinical care, and finally, identify ways to apply historical trauma-informed practices to clinical practice. I have no financial conflicts of interest to disclose. So why are we talking about trauma-informed care, and why is it important? If many of you remember, we started the beginning of 2024. We were all asked to complete a training for trauma-informed care, and we learned about these 6 principles of being an institution that practices through a trauma-informed lens. So, what I'm hoping to do is build on that and really focus in New Mexico in the work that we do in our state, um, and challenge all of us to incorporate best practices that include historical trauma informed care, especially in New Mexico, because one, we are a minority majority state with a diverse statewide community and individuals from a diverse racial, ethnic, and cultural backgrounds. So we service a wide population with a lot of rich diversity. So even though some of the presentation that I'm going to do today comes from my cultural perspective, this can be adequately applied to many non-Western communities and cultures. The other thing I want to add is this is really important. If you're all aware, Medicaid has recently made some changes that allow for traditional healers and traditional healing practices to be reimbursed by Medicaid or covered through Medicaid services. And it's important to consider the knowledge beyond our textbook, our coursework, our training, to start to include those Indigenous ways of knowing and include those cultural practices in these healing spaces that we create for our clients, our patients, and our consumers of our services. I want to start by going over the historical trauma unresolved grief model that was pioneered by our very own Dr. Maria Yellowhorse Braveheart, who recently retired. Dr. Braveheart came up with this model and defined it as the cumulative emotional and psychological wounding across generations, including the lifespan, which emanates from massive group trauma. And it's important to understand the definition itself includes the lifespan, meaning when we talk about historical trauma, we're not just talking about things that happened decades ago, centuries ago, or a long time ago. We're talking about things that include everything up to a minute ago, because everything that has happened in our lives, even up to a minute ago, has an impact on the way that we or on the way that our clients and patients relate to their environment, to systems that they are involved with, to institutions where they may seek help from or be educated from. It's the way that they interact with their family, their community, whether it's urban, rural, traditional, non-traditional, native, non-native, but all of that, everything that happens up to a minute ago has an impact. And everything that happens in our lifespan has the ability to activate some of those historical trauma responses that we were taught from previous generations. A historical trauma response is conceptualized as a constellation of features associated to reactions to massive group trauma. So an example of this may be after COVID-19, every now and then we hear that there's a rise or a spike in a different kind of virus. And maybe some of us have that immediate response to be hyper vigilant or want to mask up or start using our hand sanitizers, and be extra cautious. Those are trauma responses that came from a historical event, a mass trauma that we all experience on a global perspective. And the way that we react to news or media or any upsurge in viruses in our community or with around our community, we become hyper vigilant. Historical unresolved grief is a component of historical trauma, but it's the unresolved grief, that profound, unsettled bereavement resulting from cumulative, devastating losses and trauma compounded by historical events. So, in our history, there have been policies and procedures and legislation that have led to massive group loss. And it's that unsettled grief that we have and that we carry with us that doesn't really have a place to be resolved, but we anticipate working through it in some way, shape, or form. But sometimes, because of the scale of the mass group trauma, we carry that unresolved grief with us because it's grief that has been passed down from generation to generation. In historical trauma, in the model, there are stages that Dr. Braveheart identified and that we utilize as part of the model when working with communities. We'll go through each of these stages and I'll talk about them. The first one is confronting historical trauma and embracing our history. In this initial stage, individuals take time to confront the historical trauma that is present in their lineage, including the traumas that have directly impacted their individual family and communities. The stage focuses around learning and acknowledging atrocities, traumas, and events in one's individual family and community history. This can be difficult, but it's a critical part of the process that really helps us examine and truly confront histories that sometimes are left unspoken or unacknowledged by larger systems. In understanding trauma, then the next stage, understanding trauma, moves beyond the awareness or the embracing of history. It starts to involve understanding what trauma is, the effects it has on ourselves, our mind, our body, our spirit, and our relationships. And what kind of circumstances beyond one's control that are not the individual's fault, but acknowledging and understanding that there are outside forces, outside legislation, outside policies and procedures, and perhaps an imbalance in the greater environment that led to the trauma. And then we go to releasing the pain. In releasing the pain, this phase of the model talks about letting go of the pain by identifying how trauma has impacted, again, holistically across multiple domains, and the accumulation of confronting, embracing, and understanding the trauma. The goal of this stage is often to examine one's own pain, as well as recognize the pain of ancestors. So again, that intergenerational pain that has been passed down, that has then taught us in our present life how to interact with systems and institutions that have put upon us policies and procedures that we individually may not have control over. The counterbalance of this phase is really identifying ancestral resilience and what the practices, the culture, and the language that was instilled to give us strength to get to the next stage, or transcending that trauma. In transcending the trauma, people will embrace and incorporate the strengths and resilience inherent in traditions, values, and teachings of one's own culture, family, and community. It includes reflecting on attributes that were acquired through oral language, through cultural practices, through ceremony. And this stage really doesn't have an end, but it's an ongoing process. It's an ongoing process in how you are relational with the environment and the people around you and the institutions you have relationships with. Here's just a list of some of the historical trauma responses that can often be stigmatized or incorrectly pathologized. So there is a symptom of depression that sometimes those who have experienced historical trauma carry with them. That then informs how they're hypervigilant or how they experience somatic symptoms. But all of these things, compensatory fantasies, loyalty to the deceased, and vitality of one's own self as seen as a betrayal to ancestors. That's really important. And this is sometimes observed in college age students who have grown up in very traditional or reservation homes, and then they go off to university and they have access to resources that maybe their family at home, their younger siblings don't have access to. So that vitality that they're experiencing for the first time in college campus settings can be seen as a betrayal, not only to their family at home, but to the ancestral suffering that happened from generations before, that they have this quote unquote easy life with electricity and access to running water and access to food and resources. And you can see how that can really disrupt a person's emotional, mental health, the way that they think of themselves, even spiritually, to have a sudden abundance of resources. So I wanted to give you this basic framework because when we talk about Indigenous and non-Western communities, even our Latinx relatives, our other relatives who are non-white, it's really important to begin to understand the positionality that we as practitioners carry, especially those of us who come from very traditional backgrounds. And when I talk about traditional or indigenous, I'm not just talking about tribal communities or the Navajo community. I am talking about non-Western communities that come from a non-Western paradigm of thinking, that come from a more collectivist type of society. Now, story work has come out as a way of understanding or gathering scientific knowledge to understand how to diagnose, treat, and help individuals who come from Indigenous communities. And I want to start with some self-disclosure and a story of my own. And this is important because as a clinician and a practitioner in behavioral sciences, I bring with me the experiences and the historical traumas of my own people and our relationship with mental health, with healthcare inequity, with institutional injustice, with institutional racism. I carry all that alongside the ancestral knowledge that I carry. So I want to start by telling you that in high school, I want to say about my sophomore year in high school, my grandfather, my maternal grandfather, whom I was very close to, was diagnosed with cancer. To this day, I'm not sure what type of cancer it was, but I can make an educated guess based on the symptoms that I remember and how quickly the cancer took my grandfather. And I tell that story because one, cancer is something that is not cultural in many traditions. We don't talk about cancer. And so explaining what cancer was to my grandfather was a really difficult task. One, because there were linguistic barriers. There was no word in Navajo for cancer that could adequately explain what he was experiencing, what his diagnosis was, and what treatment could be like. In the same token, in our field of work, there is no translation for depression. So when a person from our cultural background, from Indigenous backgrounds, doesn't have a word to explain or express what they are experiencing, it can be really difficult for them to articulate the symptoms they experience or what they are going through in their daily life. And I bring these stories to you because it's so important to highlight why storytelling can be important. Because in storytelling, they're telling you their symptoms. They are expressing their experiences. So I'm going to take you through the different phases of the historical trauma model and apply this story in understanding how storytelling, how ceremony, how Indigenous knowledge is knowledge and how it is science. They go hand in hand. And if we open our minds, we can have a beautiful relationship with many of our non-Western clients and patients. I want to preface all of this by saying this is in no way a diss at science. I love science and I love it so much because when I think of science and our scientific method from the lens of a Diné Asdzáán, it makes sense. And when I think of it that way, I can conceptualize how I'm going to explain things to my grandparents, or how I would have explained them to my grandparents who are non-English speaking, who are never educated in a westernized educational system. We'll start by confronting and embracing history. Science, I thought this was a beautiful quote that really summed up the relationship with science. Until the lions have their storytellers, the story of the hunt will always be glorified by the hunter. Now, lions can't speak English. They can't express what they're feeling or what they're experiencing. So we don't know the story of what it feels like to be hunted from their perspective. And until they have storytellers, the stories are always going to come from the perspective of human hunters, those who hunt them and can tell the story. In our Native American history, it has been very similar. Science has always glorified the Western ways of knowing and creating knowledge. Until Indigenous voices are given the space with the same reverence, respect, and approach, science will always glorify that Western approach. So if we can understand that part of our history has been our historical paradigm of understanding science has been grounded in this foundation that Indigenous knowledge is not adequate. It is not real knowledge. It is not real science. If we can just confront that, name it, and embrace it, we can begin on some common ground. And by naming it and acknowledging that Western science has been incorporated into tribal cultures for assimilation purposes, for colonization, for disrupting cultural practices, eliminating languages and traditions, and access to equitable healthcare that came from understanding and perspectives that were grounded in community, we have a place to start. So we're confronting and embracing history by acknowledging that Indigenous voices have not always had a space when it comes to scientific inquiry. Dominant narrative has always been told, interpreted, and retold and reinterpreted from dominant perspectives. So when we think of some of the ways that we apply intervention or even research, it has always been for us, made by someone else to benefit systems that were not for our own benefit. So in confronting this and understanding Indigenous knowledge, it's a question of by us, for us, to benefit us, and getting away from this strong dependence on quantitative data, on the reliance of quantitative data, but opening that paradigm for qualitative data and stories to unfold. And if you listen to the stories, the quantitative data can begin to emerge on its own. Science has traditionally been very individualistic. It's focused on individuals. It has also been reductive, right? We reduct down from a hypothesis, we test it, and we come down to our findings and our analysis. So in these ways, it doesn't really fit the paradigm of Indigenous communities that come from a community collectivist perspective, one that is relational, not just to the people that we are around or our communities, but it's relational to the environment, the plants, the animals, the water, the seasons, the cosmos, the way that the stars align. And it's really important to begin to understand that all of that comes from an Indigenous way of knowing and Indigenous science. In science, and scientific understanding from the Indigenous perspective, we can begin to break down these westernized paradigms and incorporate Indigenous knowledge by beginning to understand how trauma impacted that lack of reverence or that lack of inclusion for Indigenous voices. So here, this is always really interesting to me. In some Indian healthcare facilities, you'll see something like this, especially on Navajo. This is an example of one that you might see on the Navajo Nation. And it says, Deidre Yellowhair, how are you feeling today? And there are different emojis that roughly translate or give an idea of what the emotion is, like sick, shitka konizgai, shitka, my body, my spirit, my soul, the person that I am is hurting throughout, is hurting throughout. That is how the interpretation for sick. Too hot, too hot. So maybe I have a fever. So you don't have, shiftes doing, go shiftes doing. I'm really hot and I don't know why. There's even spooked this years, like I was spooked. And so language is a huge part of dismantling these misunderstandings and understanding how trauma and that forced colonization and assimilation to speak and standardize English as the standardized language across cultures has broken down the ability to really have good communication. I want to take you back to my story about my grandfather. Cancer. When he was diagnosed with cancer, we described it, or when we were talking about it in our familial spaces, we'd often describe it as tlodonantsihe, or roughly translated, the wound or sore that does not heal. The wound or the sore that does not heal. Now, if you take that into perspective, you can understand why cancer is a taboo subject and why there might be reluctance to seek early intervention or screening. Because if you're faced with something that does not heal, how do you begin to understand what treatment interventions might be? Along the same line, in our, when people are diagnosed with cancer or other co-occurring physical illnesses, it impacts our mental health. I remember a time when my grandfather had no way to express it. And even I, as a Navajo speaker, often don't know how to explain what depression is. There is no direct translation for depression in Navajo. And we'll revisit what that looks like in transcending the trauma, or what the translation or how we come to understand the opposite of depression. There's a word for the opposite of depression, but there is no word to directly translate depression. And that is key for individuals. And if you think of other cultural languages that are not based in English, how do we begin to understand symptoms and experiences when there's no direct translation? So in understanding trauma, this stage moves beyond just the awareness or the embracing of history, or it goes on to really examine the ways that trauma impacts the psyche, the mental, the spiritual, the physical, all the different domains that make us whole. Again, in westernized thought, and if you even just think about our hospital systems, everything has its own department. If you want to get your eyes checked, you go to the ophthalmologist. I know when I have medical health care appointments, I'm driving all over town. Sometimes I'm in Rio Rancho. And even that following up I can feel almost dismantled because if ophthalmology is over here and my PCP is across town and my dentist is in another location, I'm just disjointed. I'm everywhere. I'm scattered all around Albuquerque and Rio Rancho. And if you think of it for our rural natives who live on reservations or very rural areas, how incredibly um, disorienting it can be to leave their home location to travel to a place like Albuquerque or be referred to clinicians here in this urban setting. So in understanding trauma, we have to also acknowledge that non-westernized people or indigenous people, and I use indigenous very broadly, have complex relationships with non-indigenous systems such as governments, healthcare, schools, judicial systems, and many of these systems have a strong history of perpetuating trauma on American Indians and Alaskan Natives, those or indigenous communities on a broad spectrum through oppressive policies, practices, and procedures. So, and in this stage, it's encouraged that participants or people who are examining how they understand the trauma that they've experienced, we also counterbalance that with exploring their own strength and resilience, as well as healthy attributes that were passed down through language, culture, and community and traditional practices. So this is where language, culture, and ceremony really come in to fitting this scientific paradigm. And when we understand that there is space, we can begin to transcend that trauma. And I want to talk about this from the perspective that research is ceremony. Research is really, or ceremony is research. Ceremony is science. When we think about traditional or non-Western practices from indigenous cultures, ceremony is a science. Ceremony really has a systematic process that has its own protocol and procedures. If you ask for ceremony, oftentimes the helper or the practitioner, the traditional practitioner will review everything that is known, whether it's in the in this physical world of what we can see or the natural cosmos. Are the stars aligned? What is happening in the environment? You know, one of the traditional practitioners from my community warned about the northern lights being seen, being observed so far south, that was a signal that there was something out of balance. And all of those things, reviewing what is known, reviewing what is observed, listening to whether it be current news in the community, news in the state, news in on the national level, or news in the global community. All of that is relative to who we are and our positionality as community members of these greater systems. And then there's data presentation and formulation of a hypothesis or a diagnosis. Those findings are then discussed, whether through, and those findings are discussed, a diagnosis is made, a testing of the hypothesis, and an analysis of the results. From there, practitioners and the patient, usually together, draw conclusions. And even in that, there's a methodology to how those conversations happen, how the healing happens, and what tools are used. And that informs the outcome. And the outcome isn't this tangible healing that happens, but it really is this ongoing process of how one relates to systems, institutions, how one relates to family members, how one relates to the environment, how one relates to the global community. All of that has a space. And when we can make room for that, when we can make room for understanding that ceremony and traditional practices really is a science, we can start to release the pain for our Indigenous clients and consumers of our practice. It really is helping clients to identify ancestral resilience and the encouragement that they carry to survive, as well as the ability to move forward and progress beyond trauma. So, another story that just came up and I thought of right before this, my oldest child was presenting um, a presentation on youth perspectives of Indigenous wellness. And as they were preparing, they said something really powerful, and I wanted to share it in this particular slide. But releasing the pain is really understanding and seeing yourself as your ancestors see you. It is that calling upon ancestral knowledge to take you beyond the pain and the trauma that has occurred to transcend and come out on the other side with strength. And sometimes that process can happen through an overnight ceremony, through talking circles, through talking with elders, through storytelling, through gathering around and going through specific processes and teachings. So as you're transcending the trauma, it really is embracing and incorporating those strengths that are inherent in our traditions, beginning to incorporate them, beginning to allow our clients to utilize their traditional language, even if you as clinicians don't understand. If you don't understand, it's okay. Create a safe space where they can utilize their language or help you understand what it means or to create hojon. The opposite of depression in Navajo is hojon nashada, that I walk in beauty, that I walk in balance, that I walk with holistic health and wellness. That's such a contrast from how we in English understand depression. So if someone comes to you and doesn't directly explain that they're experiencing depressive symptoms, but they want to, and they express, I want to walk in beauty. I want to walk with holistic health. It's the story of how they may be experiencing symptoms that lead to imbalance, maybe not necessarily depression, but it captures what they want. It captures the outcome that they are seeking. It captures what they're hoping for, because in their traditional and Indigenous minds and lens, they don't have a DSM checklist of symptoms to describe what they're experiencing. They just know that something isn't right. Something is off balance, and they want to get back to that space of hojon, or balance and beauty. And I share these stories with you because really storytelling is part of the medicine. Storytelling is part of the healing. When my grandfather was diagnosed with cancer, he pulled me aside one day and in Navajo told me, go to school. Yego and do it with grit. Go to school. Go to school and do it so well that you understand this system and it becomes your armor. It becomes your weapon, and bring it home to our people. And he didn't mean just our Navajo people, our Navajo community, but he was thinking about our global Indigenous community. Learn this westernized scientific system so well that you can translate it and you can use it as armor and use it as medicine. And I had no idea at that age. I don't remember when I decided, and I don't even think I decided to become a psychologist. There's no one in my family lineage, in my history, that ever studied psychology. And when people ask, like, how did you choose this profession? I don't know. And I truly believe that the profession chose me. Because that message from my grandfather, all of those things informed, I observed, I transcended, and I became the evidence. Today, if my grandfather were alive, I could reassure him that cancer was not a death sentence, that there were survivors of cancer, that the sadness that he was feeling is normal, and that he could get through it. And that in honoring our tribal ways, our culture, our traditional healing practices, that we could find our way through. When I think about it, a lot of times I grew up academically. I grew up in academe, knowing that my voice didn't really have a position or a space, because we're often taught to think about, where is the evidence? Where is the evidence in this evidence-based practice? Where is the evidence that this intervention works? Where is the evidence that if we burn sage, it's going to be curative? I am the evidence. My colleagues, Jennifer Nanez and Teresa Gomez, who are faculty members in community behavioral health, Dr. Tom Chavez, we are the evidence of generations of medicine, traditional tribal languages. We are the evidence that with intergenerational healing, tribal sovereignty, cultural revitalization, and traditional healing practices, we have thriving and safe communities. We've had positive childhood, family, and community experiences that provided consistent corrective experiences and cultural identity development that informed our cultural values and our coping mechanisms, that provided us with wellness and balance and knowing what Hojona shadow means. And that is a conceptualization that, even though my colleagues don't speak Navajo, that they can understand through their own community, through their own language, through their own traditions and values. And through that, we have been able to conceptualize what a meaningful life of longevity is. And that is how science, Indigenous knowledge, is science and deserves space in understanding and being spoken and being used as a companion in treatment, with all the wonderful ways we were trained in our westernized schools of thought, in our westernized training and practicums and practice. And there is evidence. The idea that I don't remember how I chose psychology, but psychology chose me. I am here because the stars aligned and I'm meant to be, despite all the obstacles, despite everything. Because statistically, if we only looked at things quantitatively, statistically, I'm not supposed to be here. Ade na ade kiddish na holo. I said, now, do you all have any questions? Do na ade kid na holo da e ashin ako. If you don't have any questions, that is okay too.
I don't have any questions. I'm just blown away. So I'm also crying over here, so I can't ask any questions. So it was a wonderful talk.
Thank you so much.
I don't
It was I can say this, it was a really difficult presentation to put together because there's sometimes this fear that when I talk about my positionality in science, it's going to be convoluted as new ageism or I don't know, woohooism, that it doesn't make sense to other people. And it's okay that it doesn't make sense to non-Indigenous, non-tribal people. So long as it makes sense to me, because it's my experience and it's the experience of our clients. I'll share with you another story since I have time. When I first came to UNM, I was working in one of our tribal communities doing clinical work. And I started working with this elderly client. This elderly client, when she first started working with me, would not speak English. She would only speak her native language in every session. Now, I couldn't get an adequate psychosocial background if she wasn't speaking a language I understood, but I understood the nonverbals. I understood the crying. I understood the pain in the cry. Over the next couple months, she began to code switch. Every now and then, only what she wanted me to know, she would say in English. And as we built, a relationship, eventually she got to a point where she was speaking in English throughout our whole session and was talking to me. But from the very beginning of our relationship to the very last session we had, she would always tell one of 3 stories. And those 3 stories always involved and always ended, and that is why you don't trust Navajos. She knew I was Navajo. She knew I was Navajo, but the 3 stories she told in rotation always ended with, and that is why you don't trust Navajos. And I could have been insulted, but she was telling me something in telling those stories over and over again. She was telling me something in reminding me why she particularly had experiences that informed her that she doesn't trust Navajos, but she trusted me. She trusted this Navajo. And she trusted me enough with her storytelling. I think we're coming to the end here.
Mhm.
I'd like to thank you all and say thank you for this opportunity to have my language spoken in such a sacred academic space. But furthermore, I take on the name Yellowhair because that's the name of my grandparents. I was very intentional of taking on that name because their names are forever immortalized in spaces like this.
Thank you, Dr. Yellowhair. Wonderful presentation. Brings a lot of great, deep, intimate reflection beyond questions that are part of the quantitative world, right? Our conventional science is all about questions, but part of that science is also that reflection piece. And I think you've given us this opportunity to do that. So thank you very much for taking this invitation to present your wisdom and your knowledge. Thank you, everyone.
Great job, Dr. Yellowhair. Awesome, as always.
Mhm.
Wonderful, 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 Dr. Yellowhair.
Thank you.
Good
Teresa.
job, sister.
Thank you, sister.
Way to go, Deidre.
There's some really nice comments, so I hope you get a chance to read them before they go away.